Next, Mr. Johns, please, for 2.5 minutes.
Yeah, Minister, the Substance Use Assistance Program has continually been oversubscribed. In 2021, there was applications and proposals up to $350 million, and the amount funded was $59 million. And there's still no funding allocated in the budget for SUAP beyond 2024-25. Can you provide a breakdown for how many proposals the government received in 2022 and 2023 for SUAP, as well as the total funding versus the total amount funded?
I can tell you the number of projects that we are funding by province
Would it be
and
something
territory,
that you could table to this committee and produce that to the committee?
I believe that officials can table that information for the committee, yes.
Minister, you can hear the urgency in my voice. I mean, I live in a community. Well, first, I went to Portugal. There was 6 deaths per million based on drug-related deaths. Canada's 180 from the poison drug supply. BC's 430. My island health is 503. In my community, under the age of 59, it's 2,100 deaths per million. This is from fentanyl, benzos. This is not from safer supply. This is from a street supply trank of mixed drugs. You had an expert task force. This government did, made up of police chiefs, social workers, experts, drug policy experts, people with living experience, Indigenous leaders. They made clear recommendations that you needed to stop criminalizing people who use substances, provide a safer supply to replace the street drugs, and to ensure that you invest heavily so we have just-in-time treatment, recovery, prevention, education. And you haven't done that. It hasn't done at the scale that's needed. I want us to get to 6. We can have hope that we can get to 6 deaths per million. Every death is too many. But when are you going to come up with a plan, and will you reinstate the expert task force so that they can give and guide your government on recommendations and hold you to account in making sure that you have a plan and timelines to implement it? Will you reinstate that task force to do that?
What I will say is at this time we have done a renewed launch of the CDSS to be able to enable us to not just look at what the experts have to offer in specifically to the toxic drug supply and those who use substances, but also the other social determinants that feed into to individuals who are struggling. I've seen some positive news. Yukon has declared a state of emergency and has provided a comprehensive plan of how they wish to go forward in addressing their toxic drug supply and overdose crisis. BC also has a plan that we've been working with them on. And as I said before, the urgency is there. We know the urgency is there, but we also need the provinces working with us on going forward with that. And I'm committed to working with every province and territory that comes to us and says we need help in getting a plan forward that makes sense for our province and our jurisdictions.
Thank you, Minister. Thank you, Mr.